Hi, I'm Dr. Mayank. I'm a board-certified plastic surgeon and a diplomat of American Board of Hair Restoration Surgery. I have been running a trichology and hair restoration practice in New Delhi for the past 12 years. So post-operatively, indoors, you don't need to wear anything on your head. You can leave it open if people around you are comfortable with the appearance what you have. But when you exit outdoors, we personally advise that you should have a surgical cap on top of your scalp so that there is no exposure at all to any kind of dust or sunlight. And on top of it, you can wear any loose headgear. I would like to personally demonstrate how we should be covering this thing, for which I would request one of my team members to please come in and we can just take it from there. So once you are about to exit, please, whatever surgical cap we have given, you have to just open this thing up. It is sterile and has a surface where your hair will not get entangled. When you have to wear this surgical cap, we place it with dilated fingers first onto the forehead and then take it down towards the back. Always do this step in front of a mirror so that there is no part where you cause any friction while you do this. When we want to remove this cap, you can always take it off, pulling the elastic from the back and taking it from the back to the front. On top of it, when you're going out, obviously this would feel weird wearing a surgical cap and going out, so you can practically use a loose beanie or a bandana or a patka or any kind of a loose headgear, and you can just dilate that and adequately, without causing any friction, make the person wear this. This could be helped with any kind of an assistance from anyone. You could see to it that there is no visibility of any side and it could be just covered in this manner. This is going to take care of your exterior non-exposure to any kind of sunlight or dust. You need to do this for the initial 10 days post-surgery. After the 10th day, you may not require any surgical cap. We can directly wear a loose headgear onto the scalp. Thank you. Today we are going to talk about what kind of care do we need after 48 hours of the surgical intervention. So the first thing is what to expect just after surgery. So first 48 hours of the procedure is something in which we have given you a complete head bandage which comes off after the 48 hours. So what can you have? You can have mild amount of redness, some amount of clots, some itching and mild pain or discomfort with the medications that you are on. The medicines that were given to you post-operatively, you need to continue all those medicines in the ways given. Just the painkillers become completely SOS. That means if you have pain, then take it. If you don't have any kind of a pain, then you can reduce the dosage of this medication to maybe once in a day, or if it is more, you can increase it to even twice a day. Once the bandage is opened in the clinic, we offer the first shampooing to be performed at the clinic itself, where we teach you every instruction of what needs to be followed. We will be demonstrating in an entire video, but what you need to follow grossly is either you can take the shampoo in your palms, rub it in your palm itself and gently dab on top of the transplanted area. Please do not cause any kind of vertical or horizontal friction onto these follicles. If you feel apprehensive or scared doing this, you can take a mug with some amount of water, put a cap of shampoo, make a lotion of it and then just gently pour on the entire scalp. Let the shampoo be on your head for about 2 to 3 minutes. In the meantime, you can take your body bath, following which you can gently pour with a mug of water, around 10 to 15 mugs. You may keep the other hand in between with dilated fingers so that there is no pressure when you pour the water on your head. I would personally request, do not use a high shower because it would have a lot of pressure which can dislodge these follicles. You may use a hand shower with a very sprinkling kind of a reduced pressure, and you can gently just keep moving that water on the head for about 2 to 5 minutes to wash the shampoo off. After you have shampooed your scalp, to dry the scalp, please do not use a towel because it can cause dislodgement of the recipient follicles. Let it dry on its own. You can just sit underneath a fan, and post that, for the donor area, you may just use a clean handkerchief to dab that area to dry it out, irrespective of it being an FUT or an FUE. Once the donor area has dried out completely, please take an antiseptic ointment, which could be a Neosporin eye ointment, it could be a mupirocin ointment. Just take a tiny pea-sized ointment onto a clean finger and help someone apply that onto the donor area. Specifically, if you have undergone an FUT, you can choose to apply that just onto the stitches. Once this part is over, if you have undergone the temporal triangle reconstruction, in that case, we advise you to apply a plain aloe vera gel in the downward and backward direction on both the temples. Why we need to do this is the fact that when you chew, your muscles of mastication for chewing make the flatly implanted hair follicles stand out. We don't want that. So what I advise is that you apply this aloe vera gel at least for the first 3 to 4 months onto the recipient area of the temporal triangle alone. So initial 48 hours you had a bandage to secure your entire scalp, so sleeping was relatively easier. For the post-operative phase after 48 hours, once the bandage has been opened, what you need to follow is keep a thick, soft pillow underneath your head and shoulders, and you can use a flight pillow which we use for the neck support. That will keep your donor area relatively untouched and it will not cause any pain or discomfort. If you wish to sleep sideways, you may choose to do that, but please avoid sleeping prone on your abdomen with your face down, because that has a propensity of adding swelling onto your face as the fluid can gravitate down. The next aspect comes is what to wear. I personally advise my patients not to wear anything which you have to move from the head down. So preferably wear all front opening shirts, jackets, sweaters as per the season, whatever you have. Avoid any kind of friction to these follicles for the first at least 10 to 12 days. That is the most critical and important phase for your hair to have the kind of results that we expect. In terms of resumption of normal life, your life is as normal as what it was before the transplant. 48 hours post-surgery, you can resume your intimacy with your partner. You can continue with your routine activities, you can do your walks, your brisk walks. Avoid any kind of vigorous workouts for the first 2 weeks. So avoid any gymming, jogging, swimming, cycling. Anything which causes excessive perspiration should be avoided in the first 2 weeks, following which, when you begin, you should always go slow, and slowly you can increase the intensity as well as the distances and the hours of involvement in terms of the workouts. You can have anything to eat, but in specific we are going to give you a printout of what exactly are the things which would be beneficial for you and what are the things which are harmful for you. What comes as a major query from most patients is, when can I resume my liquor consumption, when can I have caffeine, when can I have green tea? So all these things we usually recommend that you should be avoiding for at least the first 72 hours, following which you can always take things in moderation. Irrespective of you washing your scalp on a daily basis, you will develop some amount of scabbing into the recipient area of the hair transplant over a period of 10 to 12 days. If you do develop those scabs and you can come into the clinic, we can do the needful in terms of the cleaning of the scabs for you. If you cannot, you can always have a video call with us where we can assist you and help you clean your scabs at your own doorstep. Once 5 days of your antibiotics and analgesics are over, post that we advise each patient to go ahead and consume the medications to prevent further hair loss. These medicines can be grossly classified into 3 zones. The first one is oral finasteride, which has several myths attached to it. Let me assure you this, that the dose at which we would be prescribing you, I have personally not seen any individual develop any kind of sexual side effects, what is normally a myth along with finasteride. We also advise you to consume certain multivitamins which are given to you in a form of a cyclical nutritional therapy, along with a topical application of minoxidil lotion or spray, which you can use after the 12th day of the hair transplant. What I personally recommend is that the scabs should be always cleaned completely, following which you can always begin the minoxidil application. If with the scabs you start spraying the minoxidil on scalp, you will have gross amount of dandruff, flaking and itching, which would not be tolerable. Post-transplant, we all are super happy seeing the kind of fullness that we have developed on our scalps. But be very cautious and aware of the fact that you will lose every hair follicle that's going to be implanted in the coming few weeks post-surgery. Don't be scared, don't be apprehensive. You will grow each follicle over a span of 3 to 5 months post-operatively and will have a significant difference in your appearances in a span of 5 to 6 months, which would increase in density over the next 9 to 12 months post-operatively. If you have any further queries, concerns or doubt, please feel free to contact us at Crown at the number given below. Till then, I wish you all the best. Take care of yourself. Thank you.